The fluorescent lights hummed their mechanical prayer as Danielle Ross moved through St. Michael's ICU at 5:08 a.m. Her scrubs faded from 1,000 washes, her hair pulled so tight it felt like an anchor. The pre-dawn shift belonged to people like her, the ones who didn't need sleep or had forgotten how to find it. Bed 12 had arrived at 3:15 a.m. Sergeant Major Dylan Corver, 52, multiple GSWs from what the admission notes called a training accident, though something in the casualness of that phrasing made her hands pause. She didn't trust casualness when it came to marine injuries. The monitors above his bed painted his vitals in green numbers and shallow arcs. BP 118/71. Heart rate 84. O2 sat 94 on 2 liters. The numbers looked stable in the way that precedes disaster, a silence before the thing that breaks it. Danielle pulled his chart, noting the attending physician's notes with the precision of someone who had learned long ago that details were the difference between living and the alternative. 3 surgeries completed. Wounds cleaned and closed. Standard post-operative care ordered. The notes were crisp, professional, and missing something her hands could feel before her mind could name it. An electrolyte panel from admission, nothing more recent. No follow-up orders. No reason to look deeper. She began her assessment with the kind of methodical attention that made newer nurses think she was just thorough, when really she was reading a body the way other people read maps. She checked the 4 sites first: right arm, left arm, both lines clear and running. The chest dressing was dry. The drainage tubes were dark but moving, which meant his body was healing at the pace it should. She leaned close to his face without touching him, listening to the rhythm of his breathing. In and out. In and out. Mechanical but sure. Her eyes traced the visible contours of his chest, looking for the asymmetry that would signal an air leak, a collapse, the early whisper of sepsis moving through his tissues like smoke. That was when his wife entered carrying a jacket. The woman was perhaps 50, with the kind of face that had learned to smile without feeling it, and she moved toward the bed the way people move toward something they're afraid might disappear. She held the jacket like it was sacred. Brown leather, worn soft at the edges, the sleeves creased from 1,000 arm movements. She looked at Danielle with the question in her eyes that all families asked, "Is he going to be okay?" Danielle nodded once. A professional nod. A nurse's nod. She returned to her charting and didn't look up when the wife draped the jacket over the back of the visitor's chair, a small ritual of bringing home into a place that had nothing to do with home. But then something caught the light. A small, faded patch sewn into the interior lining of the jacket. Danielle's eyes found it the way a dog's head turns toward a whistle only it can hear. The patch was dark blue with a number, 3 to 7 in gold lettering. Below it, 2 words, Dark Horse Battalion. And below that, in letters so small they almost weren't there, Bagram, 2019. Her hand stopped moving. She didn't look up. She didn't change her breathing. The trembling that wanted to happen somewhere deep in her chest stayed where it belonged, internal, private, a thing that no one could read on her face. 2 seconds passed. 2 seconds of Danielle standing absolutely still, her eyes fixed on the monitor numbers that hadn't changed. Then her hands moved again, resuming their documentation as though the patch had been nothing more than a thread-catching light. But she knew. She knew the Sergeant Major before she knew his name. Dark Horse Battalion, 3rd Battalion, 7th Marines. The unit that had carried her son PFC Marcus Ross to the medevac 7 years ago after the ambush near Sanjin. The same unit whose commanding officer had held his body upright when Marcus's legs stopped working, whose hands had kept pressure on wounds that looked like they were already deciding to stop fighting back. She had seen the after-action report, the brief paragraph that mentioned the Sergeant Major by name, Corver, D, NCO in charge of Quick Reaction Force, immediate action under fire, no casualties lost. The clinical way the military described someone saving lives. No casualties lost. As if you could lose them, as if there was a finding them again. She had never met him. She had only seen his name on a form and held her son's hand while Marcus described the hands that held him, the voice that didn't stop talking to him during the 200 meters to the bird, the presence that Marcus said was like being inside concrete, solid and unbreakable and there. Her son had come back with one less leg below the knee and all of his life ahead of him, and somewhere in the fog of morphine and surgery and those first days of accepting impossible things, Marcus had said, "Tell him I made it. Tell him that matters." She had never told him. Danielle Ross, Captain Danielle Ross, though nobody here knew that, though nobody here knew much of anything about her, continued her assessment. She checked his wound drainage, his flow rates, the placement of his Foley catheter. She documented everything in the electronic chart with the kind of precision that looked like administrative duty but was actually survival. You documented everything because documentation was protection, because if something went wrong, people would look at what you'd written and either see evidence of competence or evidence of negligence. She had learned long ago that details were weapons and shields both. She pulled the old admission labs one more time, reviewing them on her screen. The electrolyte panel from 3:15 a.m. when he arrived. Sodium 138. Potassium 5.1. Magnesium 1.8. Nothing that screamed emergency, nothing that looked wrong on the surface the way someone untrained would look at numbers and shrug. But she had held enough dying people to know that the surface wasn't where death lived. Death lived in the places between numbers, in the deterioration that happened when nobody was looking, in the moment before the monitor began its frantic screaming. The sergeant major's eyes moved behind his closed eyelids. REM sleep or pain, she couldn't tell yet. She would check on him again in 30 minutes, and again in 30 after that. She would watch him the way people watch things they were responsible for keeping alive, which was what all nurses were, though most of them didn't think about it that way. Dr. Mercer arrived at 7:31 a.m., his white coat already open, his tablet already glowing with the morning's charts and the numbers that mattered to him, not vitals and drainage and the small signs that meant the difference between morning rounds and a code blue, but billing codes and procedure lines and the careful architecture of a fraud that had been holding his life up for 3 years now. He moved through the ICU with the confidence of someone who had never been questioned, whose presence had never been doubted. The nurses at the station looked away when he passed, a small instinctive thing that meant they knew something wasn't right but had decided not to speak it aloud. He glanced at bed 12 for perhaps 2 seconds. His eyes registered the sergeant major as a body, a set of vitals, a line item. His gaze moved to Danielle, who was standing at the computer terminal, her hands poised over the keyboard, her expression the particular blankness that competent nurses developed when they were working in systems that didn't serve competence. Something in her caught his attention, not her face, which was forgettable by design, but the way she stood. The way her shoulders held themselves. The way her eyes had been moving through the room with an assessment pattern that didn't match her job description. "Morning, Danielle," he said, and his voice was the voice of someone greeting a piece of furniture. Polite without presence. Acknowledging without knowing. "Good morning, Doctor." Her voice was steady, level, the voice of someone who understood their place in a hierarchy and had accepted it. Sergeant Major Corver's vitals are stable. Dressing is clean, drainage minimal. I'm ordering a comprehensive metabolic panel and an updated EKG. Dr. Mercer's jaw tightened by perhaps 1 millimeter. His labs are current. From admission. 28 hours ago. There's no indication. Pain is information, Danielle said, and her hands didn't move from the keyboard, and her eyes didn't move from the monitor. I'm ordering the panel. The silence that followed lasted perhaps 3 seconds. In that silence, Dr. Mercer calculated whether this small objection was worth addressing, whether the nurse with the faded scrubs and the tied-back hair represented a threat to the carefully balanced machinery of his days. He decided, in that moment, that she did. Something about her was asking questions. Something about her was looking deeper than the surface. He didn't know what. He didn't know that she could read the electricity in a room the way soldiers read terrain. He didn't know that her hands had held bodies together in conditions that would have made him vomit. He didn't know that the woman he was looking at had spent 11 hours on a Bagram rooftop with a rifle and 300 rounds and the knowledge that if she left her post, Marines would die. He didn't know that she had carried a man downhill through sniper fire, that she had performed surgery in a Black Hawk that was losing hydraulic fluid, that she had been decorated for courage in circumstances he couldn't imagine and then buried so deep in classified records that she had learned to disappear by simply existing quietly in rooms like this one. He only knew that she was a problem. "Fine," he said. "Order the panel. But I'm not sure it's necessary." "No," Danielle said softly, and her hands continued their work on the keyboard. "But it might be necessary. That's why we order it." He walked away. And in walking away, he didn't yet understand that he had just begun a trajectory that would end with him driving a medical supply van in the rain, or that the woman whose order he had reluctantly accepted would be the reason for all of it, or that the thing he thought he could control, the system, the narratives, the machinery of blame that protected the guilty, was about to be dismantled not by confrontation but by competence, by a nurse who would simply do her job with the precision of someone who had learned the cost of failure. The sergeant major slept on, his body healing according to processes that would not wait for permission, his vital signs beginning their subtle deterioration in the hours before anyone would notice, before the machines would begin their screaming, before the night shift would reveal what the daylight had been too blind to see. Danielle made a note in the chart: monitor for hyperkalemia, consider for calcium gluconate availability. And then she turned her attention to the other beds, to the bodies under lights, to the small quiet work that nobody praised because it happened in the spaces between emergencies, in the moments when things were still stable enough to be forgotten. But she was not forgetting. She was watching. The metabolic panel came back at 10:47. Danielle printed the results herself in the back lab, her fingers steady on the keyboard, eye scanning the numbers that made her breath catch once, just once, before she resumed her composure. Potassium, 6.8. Normal range ended at 5.0. The sergeant major's levels were already climbing into the danger zone, the kind of silent killer that could stop a heart mid-beat with no warning. No symptoms until collapse. No second chances. She clipped the results to Corver's chart and walked to the nurse's station where Dr. Mercer was reviewing imaging on his tablet, his face arranged in the kind of serene confidence that only came from never being questioned. "Dr. Mercer," she said, keeping her voice level. "I ordered a comprehensive metabolic panel on Sergeant Major Corver. The results are concerning." He didn't look up. The fluorescent lights above cast everything in that harsh white that made skin look like paper. "I didn't authorize that order, nurse." "No, sir. The panel wasn't on the initial protocol. I noticed his baseline labs were incomplete, no electrolytes, no kidney function. Given his presentation, I thought." Now he looked up. His eyes moved across her face like a predator assessing prey. "You thought? Tell me, Donna, what medical degree did I miss in your file?" The use of the wrong name was deliberate. She heard it land. 3 other nurses at the station suddenly became very focused on their computers. "My name is Danielle." And the panel revealed. I know what it revealed. Marginal variations in a critically injured trauma patient whose systems are already compromised. What I'm interested in is why you believe you have the authority to order tests outside the attending physician's care plan. He stood, and his voice dropped lower, the kind of voice that traveled down hallways and echoed in ears long after he'd finished speaking. This is exactly the kind of cowboy nursing that costs hospitals money and patients their lives. You ordered an unauthorized test, incurred costs we didn't budget for, and now you're wasting my time explaining why you couldn't stay in your lane. His potassium is elevated, she said. The words came out steady, measured, each one a small stone dropped into still water. It's climbing. Without intervention. Without intervention, we manage his comfort and acknowledge that some patients are beyond our resource allocation. I've made that decision. Now you need to make one. Are you going to accept the care plan I've established, or am I going to have a longer conversation with hospital administration about your pattern of insubordination? The room had gone quiet. The kind of quiet where you could hear the hiss of the pneumatic door closing at the far end of the ward, the soft beep of monitors counting time in other rooms. She looked at him once, held the stare for exactly 2 seconds, not defiant, not submissive, just present, and then nodded. "Yes, doctor," she said. She returned to charting. Her hands moved across the keyboard with the kind of precision that came from muscle memory, each keystroke deliberate and clean. Around her, the unit continued its rhythms, blood pressure cuffs inflating and deflating like mechanical breathing, for pumps singing their electronic songs, the distant overhead page announcing a code in another wing. But at 1100, Dr. Mercer walked into the sergeant major's room, and Danielle followed because she was the assigned nurse, because that was her role, because sometimes you had to witness what was happening to understand the full cost of it. The sergeant major's wife was standing by the bed, her hand on his shoulder. His daughter was in the corner chair, scrolling through her phone with the disconnected expression of someone trying not to think about hospitals or mortality or the fact that her father's chest was bandaged under the hospital gown. Mercer's voice filled the small space like smoke. "Mrs. Corver, I wanted to update you on our care plan. Your husband is gravely injured. The injuries from the initial blast have compromised multiple organ systems. What we've chosen to do is focus on his comfort rather than aggressive interventions that would likely cause additional trauma and suffering." "What does that mean?" His wife's voice was thin, stretched tight. "It means we're letting nature take its course. Any aggressive treatment at this point would be futile." Danielle stood by the four-pole, her eyes on the monitor where the sergeant major's rhythm was beginning to show the peak T waves of hyperkalemia, the electrical signature of potassium toxicity. She watched Mercer's face as he spoke about comfort care and letting go, watched him use the language of compassion to describe abandonment, and felt something inside her shift into a different gear. Not anger. Anger was a luxury. This was calculation. This was the cold assessment of a threat. Then he turned to her. "This is actually a good moment to address something. Nurse Ross ordered an unauthorized test this morning, a comprehensive metabolic panel that was not part of the established protocol. This kind of deviation from the care plan is exactly what creates unnecessary suffering for families and complications for the medical team. I want to make sure all staff understand the chain of command. You follow the attending physician's orders. You don't make independent clinical judgments." He smiled at the sergeant major's wife as if he'd just explained something deeply caring. "Danielle means well, but she's a nurse. She doesn't have the training to make these decisions." The wrong name. Again. Deliberate. She felt his wife's eyes shift to her, saw the confusion and the subtle shift from gratitude to suspicion. Was this nurse unreliable? Had she done something wrong? That was the gift Mercer had just given her, doubt. Danielle nodded once. Her jaw clenched so briefly it was almost invisible, the muscles tightening for exactly 1 second before she released them and made her face smooth again. "Yes, doctor. I apologize for the deviation." She left the room and walked to the unit board near the time clock. By 11:15, a printed citation was posted there for the entire ICU to read: "Protocol deviation, Ross, D. Unauthorized testing. Resource misallocation. Failure to consult chain of command." The violation appeared in bold red letters, the kind of warning that made other nurses step back, made them question whether associating with you was safe. At 12:30, she sat down at the break room table with her lunch, a container of rice and chicken she'd brought from home, the food cooling in the fluorescent light. For nurses were already at the center table, Maria from the night shift finishing her paperwork, Josh from orthopedics on a break, Lynn from cardiac step down, and David who floated between units. They looked up when she entered. She watched the calculation happen in their eyes, the same calculation Mercer had trained them to make. Association with her was dangerous. Their eyes did not meet hers as they gathered their trays and moved to the far corner of the break room, suddenly absorbed in conversation about staffing and weekend plans. She ate her lunch in silence. The rice was slightly cold. The chicken was bland. Around her, the hospital continued, the sound of the refrigerator humming, the distant ring of a phone being answered somewhere in the building, the soft thud of the dishwasher in the kitchen behind the serving line. No one looked at her. No one spoke to her. The isolation was so complete and deliberate that it had almost a physical texture, like walking through a room filled with smoke. At 14:30, she was at the nurse's station reviewing the sergeant major's labs when she overheard Mercer in the medication room. His voice was low, meant for Dr. Patterson's ears only, but the ICU was designed with acoustics that carried. The Marine in 12 is a lost cause. Don't waste resources. Focus on viable patients. I've established the care plan. We're keeping him comfortable, which means we're managing him to natural resolution. Patterson nodded. She was new to the ICU, still learning who held power, still making the calculations about which physician's instructions to follow and which to question. She would follow Mercer's lead. They all would. By 1600, Danielle had counted. 12 doctors had walked through the sergeant major's room or reviewed his chart. 12 physicians with the authority and the training to intervene. 12 refusals. Some cited liability concerns. Some mentioned Mercer's explicit instruction that Corver was not a priority for resource allocation. One simply said, "He's palliative now. I'm not getting involved." At 1800, she was doing inventory in the supply room when she saw the boxes. They were marked for ICU procedures, intubation kits, central line supplies, chest tube trays, equipment logged as used but never actually placed. The billing codes on the inventory sheets were inflated by approximately 40%. Someone had been documenting phantom procedures and collecting payment for interventions that never happened. Someone had built a system that required compliant staff, nurses who didn't ask questions, nurses who stayed in their lane and didn't order unauthorized tests that might expose the gaps between documented care and actual care. Someone like Dr. Mercer. The realization settled in her like a stone dropping into dark water. This wasn't about protocol. This wasn't about hierarchy. This was about exposure. She'd seen the missing labs. She'd ordered the panel. She'd found the electrolyte abnormality that would be the first crack in his facade if anyone important asked the right questions. And Mercer had responded the way people with things to hide always respond, by isolating the threat, by using institutional power to discredit her, by making sure 12 other physicians would follow his directive and refuse to save a Marine whose survival might require explanation. At 2000, Mercer appeared at the nursing station with the shift assignments. Effective immediately, you're reassigned to the pediatric unit for the night shift. Collins will assume your patients here. She looked up from her charting. Doctor, the sergeant major's labs need to be rechecked at 2300. His potassium was trending. Collins will handle it. Go prepare your assignment. Yes, doctor, she said. She had 1 hour left with bed 12. She spent the first 40 minutes finishing her charting, documenting every single lab result, every physician refusal, every moment of the day she'd just lived through. Then, at 2040, she stood at the sergeant major's bedside. He was sleeping, his breathing shallow but steady. The unit patch was still there inside his jacket, faded green thread on weathered cotton, the insignia of 3rd Battalion, 5th Marines. The symbol of the men he'd led. The insignia of the platoon where her son had served as a private. She thought of the video conference call she'd gotten 2 years ago, her son's voice saying, "Mom, Sergeant Major Corver pulled me out of the compound when everything went wrong. He carried me to the medevac. I'm alive because of him." She looked at his potassium level on the monitor, 7.1 now. Climbing. Approaching the threshold where his heart would simply stop, where 12 doctors would document that nature had taken its course, where Mercer would file away the case as inevitable and continue inflating billing codes and collecting kickback payments from the supply company that provided the phantom equipment. "I'm going on break," she said to no one in particular, her voice steady as she walked away from his bed. The break room was empty. She sat in the dark for exactly 4 minutes, her hands flat on the table, her breathing controlled and deep. Then she stood, walked to the supply room, and began moving inventory boxes. Not obvious. Not suspicious. Just a nurse preparing for a shift change, moving supplies where they needed to be, finding exactly what she'd need if the situation escalated. At 2100, the sergeant major's monitor began to show the peak T waves of severe hyperkalemia. She was watching from her new assignment in pediatrics, for floors below, when his rhythm started to change. The lab printout arrived at 2100 hours in Danielle's hands like a verdict. Potassium 7.2. Normal range was 3.5 to 5.0. This was the number that stopped hearts. She stood at the nurse's station where 3 other staff members were charting, her eyes moving once across the results before she turned toward the ICU corridor. The paper felt thin. Fragile. Like it might dissolve if she held it too long. She found Dr. Mercer at bed 8, adjusting a ventilator settings on a post-op cardiac patient. His back was to her. She waited exactly 3 seconds, long enough to appear respectful, not so long that it looked like hesitation. The fluorescent lights cast everything in that particular hospital white that made skin look like it belonged to corpses. Dr. Mercer. Her voice carried no inflection. Lab results on Sergeant Major Corver. Potassium at 7.2. He didn't turn immediately. When he did, his face held the expression of a man who had just found a spider in his coffee, annoyance masquerading as concern. And? Critical range. Cardiac arrest threshold. She held the printout forward. Immediate intervention needed. Calcium gluconate, insulin with dextrose, potassium binding resin. Stat EKG. He's at risk of. I'm aware of the treatment protocol, Nurse Ross. His voice moved like oil spreading across water. I'm also aware that you've been reassigned to pediatrics effective immediately. Not your patient. Not your lab. Not your concern. The room had gone quiet. Not silent, there was still the ventilator's rhythmic wheeze, the soft beeping of monitors, the sound of a water pitcher being set down at another bedside. But quiet in the way that meant listening. Danielle's jaw moved once. A microsecond. Then stillness. The patient is critically ill, doctor. The labs suggest. Are you questioning my clinical judgment? His eyes had shifted into something different now. Not anger. Calculation. Because I would hate for your personnel file to include insubordination. You've already got recklessness documented. Another entry might make your position here untenable. She understood then what was happening. This wasn't medicine anymore. This was predator defending territory. She had seen something, the billing codes, the supply company invoices, the phantom procedures, and now Mercer was moving the pieces on the board. 12 physicians on this floor. He had called them this morning. She knew because she had watched the call log on the unit's shared computer, watched his name appear in the team directory with that little green dot indicating he was in the building, in the hospital, coordinating something. 12 doctors. She had verified it herself by checking the assignment board. 12 attending physicians, 12 resident physicians, 12 physician assistants. He had made calls to all of them. Understood, doctor. She lowered the printout. Her hand did not tremble. Her voice did not crack. She had learned very early in her service, 14 years ago in a place called Helmand Province where the sand got into everything and bullets sounded like angry hornets, that composure was a weapon. That the people who broke were the people who showed the break. Mercer nodded, satisfied. He turned back to his patient. Good. I'd hate to see someone with your potential throw away their career over a patient who clearly cannot be saved. The family has decided on conservative measures. That includes you staying away from bed 12. The lie came so smoothly. His voice like a tank idling in a garage, powerful, controlled, impossible to rush. The sergeant major's wife had said no such thing. She had been there at 1800, holding his hand, telling him about their daughter's college acceptance to Duke. That was what Danielle had witnessed before Mercer appeared in the doorway and suggested Mrs. Corver should go rest, that they were running tests, that he would update her by morning. She walked toward the elevators. Behind her, she heard Mercer speaking to the residents. Bed 12 is not a priority resource allocation. I don't want anyone spending time on interventions. The family wishes for comfort measures. Support them in that decision. Understood. The residents answered like soldiers. Yes, doctor. Understood, doctor. We'll keep him comfortable. The elevator doors opened. She stepped inside. Alone now. Her hands unclenched and reclenched. Once. Twice. The fluorescent light above cast her reflection back at her from the polished steel doors, a woman in scrubs with her hair pulled back so tightly it pulled at her temples, face a flat landscape of expression, eyes that had seen too much to ever fully close again. She got out on pediatrics and walked to the break room. The other nurses scattered like they were water and she was oil. Collins gave her a wide berth, hugging her thermos closer. Danielle poured coffee she would not drink and sat at a chair that faced the window. Savannah stretched out below, the river visible in the darkness, the lights of the city reflecting off its surface like the skyline was drowning. At 21:30, she checked her phone. No messages. No alerts. She opened the hospital system on her personal device using the credentials they had forgotten to disable, the credentials of someone who was technically still on the roster, still employed, just repositioned. The sergeant major's latest vitals scrolled across the screen. Heart rate 67, blood pressure 118/82, oxygen saturation 97%. Stable. Breathing his own oxygen. Still conscious based on the nurse notes from the shift change. But the peak T waves had been there in the 2100 EKG. The potassium was climbing. The math was simple. Without intervention, the next lab draw would show 7.5, then 8.0. The heart would become irritable, then angry, then it would stop. She drank the coffee anyway. It was cold. She went back upstairs at 22:45 on the pretense of collecting something from her old locker. The unit was quieter now. The night shift had settled into that particular pattern of activity that only looks like nothing if you don't understand hospitals, the small movements, the brief conversations, the constant monitoring happening in the background. She walked past bed 12 without looking directly at it. The sergeant major was asleep. His wife was gone. The monitor above his bed showed the EKG strip, the telltale peaked waves of potassium climbing, each peak sharper than the last, like mountains made of glass. Danielle paused. 2 seconds. 3. Then she continued to her locker, retrieved nothing, and left the unit. At 0130, she came back because she could not do anything else. She came back because the man in bed 12 had carried her son's body out of an ambush at FOB Bagram, had held him while the medevac descended through dust and incoming fire, had stayed with him all the way to the transport helicopter where Danielle, Captain Danielle Ross, then, before the redaction, before the erasure, had been waiting in surgical scrubs that were covered in blood that wasn't her blood. She came back because she had recognized the faded unit patch sewn inside his jacket lining when Mrs. Corver brought it from home, and because that patch meant she knew him, had known him, had served beside him when service still meant something before it meant nothing before it meant something forbidden. The sergeant major was barely conscious. His eyes opened when she approached, but the consciousness behind them was thin, like a curtain made of tissue. His rhythm had changed. The monitor showed 127 beats per minute, the rate climbing, the pattern degrading. She checked his chart. No interventions documented. No calcium infusions. No insulin pushes. No one had done anything because Mercer had told them not to. Staying till end of shift. Dr. Mercer appeared in the doorway at 0145. He looked refreshed. He had gone home. He had slept. He had come back to verify that his problem was still in the process of being solved. Danielle did not turn from the monitor. Shift ends at 0200, doctor. Good. He stepped closer to the bed. His presence moved like something solid taking up space in the room, not threatening exactly, but impossible to ignore. Like standing too close to something large and warm. I know you've been reviewing supply records, Danielle. I know you've been asking questions about billing. Here's some advice that I give freely, as someone who wants to see you succeed. Nurses who cause problems don't last long at St. Michael's. Collins is a team player. You should learn from her. Quiet. Compliant. Professional. Those are the nurses we keep. Those are the nurses who have careers here. She turned from the monitor. Met his eyes. 3 seconds of direct contact. In those 3 seconds, Danielle chose. She chose not to tell him that she had verified every phantom procedure, every inflated code, every kickback payment to the medical supply company that was somehow billing 17 procedures on the sergeant major alone, procedures that had never been performed. She chose not to tell him that she understood that the sergeant major's death would close a liability problem, that a dead patient couldn't talk, couldn't remember, couldn't describe the treatments that were never given but were documented and billed anyway. Understood, she said, and looked back at the monitor. He left satisfied. His footsteps moved away down the corridor with the confidence of a man who believed he controlled the outcome of things. At 0157, Danielle stood alone with the sergeant major and the ticking of machines that sounded like a countdown. His heart rate was 142 now. His rhythm had started to fragment, the beats coming faster and less organized. On the monitor, the peaks had become aggressive. The T-waves didn't look like mountains anymore. They looked like warnings. 85 seconds until brain damage began. She knew this number the way she knew her name, the way she knew the weight of a scalpel, the way she knew the sound a human chest makes when it opens. 90 seconds was the window. After that, the lack of blood flow to the brain became irreversible. After that, you could restart the heart, but the person inside it would be gone. The monitor alarmed. The monitor alarmed. A single long wail like a siren cutting through the silence of the ICU at 0158. Danielle's eye snapped to the screen. Asystole. Flat line. The sergeant major's heart had stopped, not from trauma, not from sepsis, but from the electrolyte imbalance Mercer had left untreated for 18 hours while 12 physicians looked away. Hyperkalemia. Potassium levels so high they'd burned through his cardiac conduction like acid through tissue paper. She moved. No hesitation. No prayer. Just motion. The crash cart was 3 steps away. She ripped it open, the steel drawer screaming as it slid, and her hands were already moving, muscle memory taking over from operations that officially never happened, from operating rooms in Bagram where she'd held lives together in the dark. The defibrillator pads came free from their backing. Compressions first. She positioned her palms over his sternum and pressed, counting the rhythm her body remembered, 1 and 2 and 3 and 4. Her shoulders drove the compressions, her weight behind each thrust, feeling his ribs flex under her palms like spring steel. The goal wasn't mercy. The goal was chaos interrupted. The goal was buying time. 60 seconds. The intercom crackled. Mercer's voice, hospital-wide, clinical, detached, disregard code ICU 12. No response authorized. Patient is not a priority resource allocation. She kept compressing. 40 seconds. No one was coming. She'd known that. 12 doctors had refused this case over the past 18 hours, each citation noting liability concerns, impossible odds, or Mercer's explicit instruction that the sergeant major was terminal. The nursing staff had scattered like startled birds when she'd returned to the bed at 0130 to find his rhythm degrading, the waves flattening into something that looked less like a heartbeat and more like the patient's body giving up. Mercer had appeared moments later, had warned her in that quiet voice of his, "Step away, Danielle. Some patients are beyond saving. Let nature take its course." Then he'd left her alone with a dying man and a hospital full of people who'd been instructed not to listen if she called. 20 seconds. She reached for the surgical kit. The scalpel caught the fluorescent light as she drew it free, the blade still sharp, still clean. Between the 5th and 6th rib, midclavicular line. The exact same incision she'd made in a failing helicopter over Kandahar province while rounds chewed through the fuselage and a PFC named Marcus Ross, her son, bled out in her lap. The skin parted like water. Her hands were steady. Always steady. That was the training. That was the burden. Pain was information. Blood was just data. Fear belonged to people who had futures. She cracked his chest with retractors, the ribs spreading like a surgical field opened, and reached into the cavity. His heart was there, blue-purple, flaccid, a muscle that had forgotten how to work. She took it in her bare hand and began to massage it, her fingers pressing in the rhythm that a surgeon in Kandahar had taught her 18 years ago, 5 beats. Squeeze. Release. 5 beats. The blood was warm against her palm. It was the same temperature as memory. 10 beats. 15. The monitor caught a spark. A single blip on the screen. Then another. The rhythm was fragile as glass, barely there, but it was there. His heart was beating on its own. She was still compressing, still breathing hard, blood darkening the cuff of her scrub jacket to the elbow, when the ICU doors burst open at 0207. Mercer. 2 security guards behind him. His face went through 3 colors in quick succession, white, then red, then something that might have been rage or might have been panic. The color drained away from his eyes like water down a drain. "What the hell have you done?" His voice cracked on the question. She didn't look up from the chest cavity. Her hands kept moving, kept stabilizing, kept working. Her voice came out low and even, field thoracotomy. "He's stable. Heart rate rising. O2 sat climbing." The monitor confirmed it. 65 beats per minute. 70. 75. The waveform was climbing like she'd willed it there, like her hands had convinced his body that living was still possible. Mercer's jaw clenched so hard she could see the muscle spasm from 3 feet away. He pointed at the security guards without taking his eyes off her. "Jackson, Wilson. Escort her out. Now. I don't care where. Just get her away from my hospital." "Your hospital?" The words came out before she could stop them. Low. Lethal. Not a question. His face darkened. "You just destroyed your career. And your license. And any future you thought you had. Take her." The security guards, young, uncomfortable, clearly out of their depth, stepped forward. One of them was already unclipping handcuffs from his belt. Danielle closed the chest with moves that a combat surgeon would recognize, her hands precise and efficient, every motion economical. Then she stepped back from the sergeant major's body and held her wrists out. The cuffs clicked shut. They were warm metal, hospital cold, a weight that felt like transition. The end of one life. The beginning of something else. She didn't resist as they led her out of the ICU. She didn't fight as they took her to the administrator's office on the 3rd floor. She didn't argue when Dr. Mercer appeared moments later with a folder and a face like stone, handing her a termination letter across a mahogany desk that probably cost more than she'd made in a decade. The letter read, "Gross misconduct. Practicing beyond scope. Unauthorized surgical intervention. Willful violation of physician directives. Effective immediately, your employment with St. Michael's Medical Center is terminated. You will surrender all hospital credentials, badge, and access cards. Legal action will be pursued." She took it. Didn't read it. Didn't need to. She'd known this was coming the moment Mercer had first looked at her with suspicion, the moment she'd recognized the unit patch sewn inside the sergeant major's jacket, the same patch her son had worn, the patch from Bagram, from Operation Redline, from the life she'd erased 6 years ago when the CIA had pulled her out of the field and buried her in a civilian hospital where no one would ever know what she'd been. They gave her a cardboard box. She put her things in it without ceremony. A chipped mug that read "World's Okayest Nurse" in fading letters. A dying succulent someone had given her 3 years ago that she'd never had the heart to throw away. Her badge. Her employee handbook. A photo of her son in dress blues, taken the week he'd graduated from basic training, his eyes still soft, still carrying hope. By 0230, she was walking out of St. Michael's through the employee entrance, rain falling in sheets around her, soaking through her scrubs like punishment. The parking lot lights cast everything in sick yellow. The rain tasted like copper and diesel exhaust. Her phone was in her pocket, the only number saved was a Pentagon direct line that she wasn't supposed to call unless someone was dying, and she'd used it for 18 years the way other people used prayers, only in extremis. The bus stop on Abercorn Street was 4 blocks away. She walked it slowly, carrying the cardboard box against her chest like it was something precious. Like it was everything she had left. The rain hammered down around her, around the concrete shelter, around the wooden bench where she sat with her shoulders hunched and her hair plastered to her skull. She thought about the sergeant major. His heart would keep beating because she'd convinced it to. But there would be questions. There would be security footage to review. There would be statements. And somewhere in that chain of events, someone would find the marks on her palms, the calluses in shapes that only came from holding instruments in operating rooms, the muscle memory in her shoulders that no civilian nurse should possess, the quiet authority in her voice when she'd given orders and people had obeyed. The box sat on her lap. The rain kept falling. She didn't move. Couldn't move. For 6 years she'd been Danielle the nurse, soft-spoken and deferential, the one who kept her head down and asked permission and understood her place in the hospital hierarchy. That person was gone now. Captain Danielle Ross was what remained, and Captain Ross didn't get to exist in places like St. Michael's. Captain Ross didn't get to live in cities. Captain Ross belonged in the dark, in classified spaces, in operations that would never be written down. She was still sitting there at 03:15, her scrub soaked through, her feet numb from cold, when headlights appeared at the far end of Abercorn Street. Then another set. Then a third. They pulled up in formation, professional and military in their precision, and before the rain had even slicked the windows, she knew. The Pentagon had been watching. The back door of the nearest sedan opened. A man in a dark suit stepped out, holding a folder against his chest, his eyes finding hers across the parking lot with the certainty of someone who'd spent 18 months looking for exactly this face, exactly this moment. Captain Ross. His voice was calm. Official. The voice of someone who dealt in secrets for a living. We need to talk about what happened in that ICU. And we need to talk about Operation Redline. And we need to talk about why you just saved the wrong person's life. The boots echoed on the tile before the door finished swinging open. 17-year-old Marcus Jr. stood in the St. Michael's administration office like he'd been briefed on every procedure, every protocol, every consequence, which he had. His mother had raised him on precision. He placed the shadow box on the conference table with both hands, the kind of careful you only learn when you're carrying something that won't come back. The room went still. The hospital administrator looked up from her laptop. The medical board investigator shifted in her chair. Dr. Mercer, standing near the window in his white coat, didn't move. Marcus Jr. opened the box slowly. The Navy cross caught the fluorescent light first, the ribbon a slash of deep blue against the white silk lining. The decoration sat heavy, real, unmistakable. Beside it, the Purple Heart. 2 of them, actually, each one representing a moment when the line between alive and not alive had been a question mark that someone else had answered for you. Then the framed commission. Official seal of the Department of the Navy. The words printed in formal serif, Captain Danielle Elizabeth Ross, United States Marine Corps. The silence lasted exactly 3 seconds. Then, "That's impossible," the hospital administrator whispered. Dr. Mercer's face went white, then red, then the color of something rotting. His hand moved to the edge of the table to steady himself. The sergeant major sat in his wheelchair in the corner of the room, where they'd rolled him for this moment, bandages still visible at his neck, his left arm in a sling. He'd insisted on coming. The doctor said he was medically cleared, his heart was beating on its own now, his electrolytes balanced, his lungs clearing with each breath. He looked at Danielle, who stood beside her son with her hands folded in front of her, her face the color of old marble. The sergeant major whispered a single word, "Valkyrie." Nobody else heard it. But Danielle's jaw moved, just barely, the faintest acknowledgement. Valkyrie. The call sign. The one that only 6 people in the world knew, 5 of them dead, one of them sitting in a wheelchair trying not to cry. He recognized her. The sergeant major's wife stood and unfolded a document, her hands trembling slightly as she read aloud. For extraordinary heroism in combat operations, Operation Redline, Bagram Airfield, Helmand Province. Captain Ross maintained defensive position in the medical facility during sustained enemy fire for 11 hours, providing life-saving medical intervention to 14 Marines under direct attack, including PFC Marcus Ross, her own son. Dr. Mercer made a sound like something breaking inside him. She lied on her employment application. The general from Fort Stewart stepped forward. He was a 2-star, with ribbons that went to his shoulders, a presence that made the air pressure change. He took the document from the sergeant major's wife and continued reading, his voice cutting through Mercer's stammering like a blade through silk. In a helicopter with catastrophic hydraulic failure, Captain Ross performed an emergency thoracotomy on then-Major Sean Corver using field equipment and surgical knowledge classified under Department of Defense protocols. The procedure was identical to the one she performed 48 hours ago in this hospital to save Sergeant Major Corver's life, a procedure she was never supposed to be capable of performing, a procedure she was never supposed to know how to perform, because that knowledge was classified at the highest levels of this nation's military intelligence. Mercer's mouth opened and closed. Opened and closed. Like a fish running out of water. She was under direct orders, the general continued, not to disclose her service record, her qualifications, or her identity to anyone, civilian, medical, or otherwise. Those orders came from the Pentagon. Those orders supersede hospital policy. Those orders supersede your authority. The room held its breath. Mercer looked at Danielle, and Danielle looked back with eyes like steel that had been folded in a fire. Her son stood beside her, and her hand found his shoulder. The door opened without knocking. The hospital IT administrator, a Navy veteran named Chen, walked in with a Federal Bureau of Investigation agent who had the kind of tired eyes that came from watching people lie for a living. "Dr. Mercer," the FBI agent said, and it wasn't a greeting, "I'm Special Agent Voss, Healthcare Fraud Division. We have warrants." Mercer lunged for the door. The same 2 security guards who had escorted Danielle out 14 hours earlier stepped into his path, both of them former Marines, both of them standing at attention like the flag had just been raised. Chen stepped forward with a laptop. "Sir, I need to inform you that your attempt to delete security footage from ICU bed 12 at 0312 this morning was unsuccessful. All files were automatically rerouted to an external drive per our veteran staff protection protocol. Copies have been provided to the State Medical Board, the FBI, and the Department of Defense." Agent Voss didn't raise his voice. He didn't need to. "We've identified 14 months of fraudulent billing. 847 billed procedures with no corresponding medical documentation. Intubations never performed. Central lines never placed. Surgical interventions with no operative notes. $1.2 million in kickbacks from Prestige Medical Supply Company in exchange for phantom orders and inflated procedure codes." Mercer's hand moved toward his phone. Chen reached over and removed it from his pocket before he finished the gesture. "We've also identified at least 4 cases where you denied necessary care to patients who questioned billing irregularities," Voss continued. "One of them, your patient in bed 14, discharged against medical advice 2 months ago, is currently in renal failure. She's hired a lawyer." The handcuffs went on quietly. Mercer didn't resist, which might have been worse than if he had. Resistance would have meant he still understood what was happening. Instead, he moved like a man who had already left his body behind. As they led him past the unit disciplinary board, past the very citation he'd posted there to humiliate her, Danielle watched with the kind of expression that didn't move. The sergeant major reached for her hand. "My wife told me what you did," he said quietly. "Marcus would be proud." Her son sat beside her and took her other hand. "Dad would be proud," he said. She nodded once, jaw tight, eyes wet but not falling. Never falling. The general handed her a phone. "Captain, the commandant would like a word." She took it. She answered. She said nothing but "yes, sir," and "understood, sir," and "I'm ready to come home, sir." The words were small, but they carried the weight of 6 years erased, 6 years of being nobody, 6 years of waiting for this exact moment. 6 months later, the morning light came through the windows of the VA clinic in Savannah in the kind of slant that made everything look like it was happening in a memory. Danielle stood in her dress blues, the captain's bars catching the light above the ribbon rack. The Navy Cross hung at her left shoulder. The Purple Hearts were there too. All of it real. All of it official. All of it restored. The sergeant major stood beside her in dress uniform, insisting on attending her reinstatement ceremony despite the bureau still monitoring his recovery. His arm was whole now, his strength returning in increments. He'd told her 3 weeks ago that he'd walked 3 miles without stopping. 4 miles now. Soon he'd be back to normal, whatever that meant for a man who'd been clinically dead and come back. Through the clinic window, a medical supply van pulled into the parking lot. Prestige Medical Supply. The driver's door opened. A man in a polo shirt, the kind of polo that came from a supplier's catalog, not from choice, stepped out and began unloading boxes. Danielle recognized him immediately. Dr. Richard Mercer. 58 years old. Diploma revoked pending trial conclusion. License suspended. Fortune liquidated for restitution. 5 years of supervised community service. Eyes down, hands careful with each carton, moving like a man who'd been taught a language he couldn't unlearn. He looked up once. His eyes found hers through the glass. He saw the captain's bars. He saw the Navy Cross. He saw her standing beside the man she'd saved, the man whose life he'd tried to take through inaction and fraud and the kind of cruelty that thinks it can hide behind institutional policy. His eyes dropped immediately back to the wet pavement. Inside the clinic, her son pinned the Navy Cross beside the captain's bars. His hands were steady, his father's hands, his father's precision. The general presented her with new orders, Director of Combat Medicine Training, Marine Corps Base Camp Leshan. She would teach the next generation of Marine Corpsmen the procedures that saved 14 lives in Bagram and 1 life in St. Michael's. The sergeant major saluted her. Then he pulled her into an embrace that broke protocol and didn't care. "Marcus was my best Marine," he whispered. "You're the reason I got to tell him that before Helmand." Her son joined the embrace. Outside, Mercer loaded the last box into the van, his white coat gone, his reputation ash, his freedom conditional on delivering supplies to the veterans he once dismissed. The rain hammered down like applause, and he didn't look back at the window again. Danielle turned from the embrace and moved into the training room. 37 Marine Corpsmen stood waiting. Young faces, old eyes, hands that would soon learn to hold the difference between life and death. She opened with 9 words that would become legend in Marine medical circles. The ones who have seen the worst often give the most. The room went absolutely silent. If you've made it this far, you know there's more to these stories than what surfaces. Real heroes don't announce themselves, they just keep showing up. Subscribe for more stories about the ones who save lives while the world wasn't watching. Like this video if you believe your true value doesn't need a title to matter. And comment, what would you do if the entire system told you to walk away? The answer changes everything.